From the News Channel 8 studios, let's talk live with your hosts, Natasha Barrett and Melanie Hastings.
Acne can often be an uncomfortable and embarrassing skin condition, but there is help to treat it. Dr. Yolanda Holmes from Washington, D.C. Dermatology is here to talk about some of your options. Welcome, Dr. Holmes. Hi. People don't like talking about this, and they probably come into your office and they're very embarrassed, but we're going to talk about it nice and open, adult acne. What do we do when we grow up and we suddenly have bad skin again? How do we treat this?
Well, we have many treatment options for you. There are a lot of wonderful prescription medications that we use. Some are topical, some are oral. We also have many procedures that we can do that will help to improve your skin.
So these procedures in particular, are these like a course of procedures? I have to come in once a week. How does that work?
Usually we have you come in every 3 to 4 weeks for a period of about 4 to 6 months, and it really depends on how you respond to the treatments.
Okay, so what should we be looking for? We're starting to see a little bit of breaking out on our skin. Do we immediately call you, or should we try some over-the-counter things first? What do you recommend?
If you decide to try some over-the-counter things, there's benzoyl peroxide and salicylic acid that is available to you, but most of the better prescriptions are, most of the better medications are prescription medications that you would have to see a doctor to get.
And really, if we're using acid in an over-the-counter item, it's probably not that safe for us to be just putting on and then going out in the spring and summer sun.
Well, salicylic acid over the counter is only 2%, so that would not be so harsh for you to use.
Okay, so let's talk about exactly what we're dealing with when it comes to adult acne. Bumps, pimples, but also ingrown hairs are something that can cause this?
They can contribute to other bumps forming. There are 3 types of lesions associated with the acne. They're papules, pustules, comedones, or blackheads and whiteheads as we know it, and cysts. You make them sound like totally fine and okay, and it's easy to treat, so I like that. Well, it depends on the severity of your acne. It can be very mild, but it also can be very severe. And in cases when it's very severe, we also have other medications that are much stronger and much more potential side effects.
Let's talk about those razor bumps and ingrown hairs. It's starting to get into that summertime when we want to look nice and smooth. What should we be looking to do?
Well, men who have very coarse hair in the beard area, and also women who shave with very coarse hair, can have a breakout of bumps in the area, either their underarms or their chin or their necks. But we do have medications that we use for that. We also do laser hair removal, which also helps to improve that condition a lot as well.
So you do a lot of work in your office, I bet.
We do. We do a lot of procedures as well.
Excellent. Let's talk about side effects. What kind of side effects should we be worried about when we are dealing with adult acne and also with hair removal?
Well, some of the medications for acne do make you a little more sun sensitive in the beginning, so it's always very important that you wear a sunscreen when you're outside, and especially when you're going to be outside for long periods of time. With razor bumps, the same thing. You should always wear a sunscreen. With the procedures that we always have you protect yourself before you leave the office, and we always remind you that for the next couple of days you are more sun sensitive. So sunscreen is always very important with any procedure that you have done.
And sun is around all the time. We forget it's a little chilly today, but still the sun is beating down on us. So now's a good time for us to maybe go and update our skin regimen and add a sunscreen maybe?
I think so. You should wear sunscreen 365 days a year.
On all parts of our exposed skin, right?
Right.
What number should we be looking for?
During a normal work day, I would say 15, but if you're going to be out for long periods of time, you should at least have a 30. If you're out for long periods, you should reapply it. Every couple of hours.
Every couple of hours?
Yes, that's important, because even if you get a 70 SPF, if you put it on and you're out for 2 hours, that's probably not going to help you much.
Because I've probably sweated it off. And
you probably have sweated off, and if you've gotten into the pool or swimming at the beach, you've lost it.
Dr. Holmes keeping us on task. Now you do have some exciting things coming up. You're part of the Becky's Fun Gold Cup on May 5th, and you have some great things going on with that, but you also have a promotion running with your office as well. Tell us about that.
We have a special that if you bring a friend, both you and your friend will get 50% off for any acne-related treatment that you have, which includes microdermabrasion, chemical peels, laser genesis, complexion blending, all of those things, you and your friends will get 50% off those treatments.
I think of this time of year as like a time to spring clean our house, but it's a good time to sort of spring clean ourselves.
That's right, and get
Take
ready.
A layer of that winter
get ready for the summer. That's right.
Okay, so before we go, tell me a little bit about microdermabrasion.
So microdermabrasion is a manual exfoliation of your skin. Your skin underneath is smoother, clearer. It helps get rid of the dark spots, and even with repeated treatments will help get rid of fine lines.
Excellent. These are all things I feel that I need. I feel like you're sort of preaching that I should be coming in. So we'll be seeing you soon. Dr. Yolanda Holmes, thanks for coming out to us, and we'll see you at Becky's Fun Gold Cup, too.
Okay, look forward to seeing you.
Thanks so much. More Let's Talk Live is coming up. Stick with us right here.
This portion of News Channel 8 is brought to you by Ashley Furniture Home Stores.